Hello, everyone, and welcome to this webinar. Thank you so much for joining us today. This webinar is about Smarter Dentistry, AI, and your practice. I'm joined by Dr. Nishan Dixit, who will introduce himself shortly. My name is Robiha. I am a customer success manager here at Pearl and also a dental hygienist. So today's webinar is going to cover some of the things related to AI, of course. We're going to talk about the role of AI in modern dentistry, how AI applies to a clinical setting, and how AI can contribute to supporting your diagnosis and increase your case acceptance. So if I just pass it over to Nishan, would you kindly introduce yourself, please?
Hello, hi. So, as Rabia said, thank you very much for allowing me to do this webinar. And so I'm Nishan Dixit, and I'm a general dentist who has a special interest in minimal invasive aesthetic dentistry. I qualified from Guy's Hospital in 1994 and thereafter did my VT straight away in Northwest London and worked as an associate in another practice in Northwest London as well, pretty much for 5 years, and then established and bought Blue Court Dental in 2000, practices located in Harrow. Initially, it was a single-handed practice, and we bought some property behind the practice and expanded it into what is now a 3-surgery practice, with 2 hygienists working there as well, alongside myself and my wife and the rest of the team. So initially, when I was in practice, I was involved with an organization called the AOG, which is the Asian Odontological Group, Anglo-Asian Odontological Group, get that right, sorry. And I was involved with them for the best part of 10 years in various capacities. Then once I'd finished my term and my roles with those, I moved on to the BACD and initially joined the committee's education committee, and then moved up to the board of directors and was the scientific director for a very few years, 5-6 years or so, and eventually became the leadership team and moved on to becoming president in 2019-2020. After BACD, I'm currently only involved in one other thing now, and so I'm a member of the GDP advisory board for Align Tech, and I have been for the last 5 years or so. And recently, over the last couple of years, I was involved with another organization called Safe Smiles, where myself and a few other key members for leading organizations, dental organizations, were involved in trying to help patients choose correctly rather than having smiles treated by mail order companies. So basically, what is artificial intelligence? AI has been around for many, many years, pretty much started in the 50s by Alan Turing. And he was involved in he used a machine test called the imitation game. And this was the first machine intelligence test that was carried out. So AI is simply a set of algorithms that work together to accomplish goals set by humans. Computer scientists are involved in training these algorithms. They feed them troves of data by a process called machine learning. These algorithms, they learn to recognize patterns of information, which ultimately allows the AI to accurately categorize these and make predictions about how we show it. So what is artificial intelligence? AI has been around for many years, pretty much since the 50s, and was started by Alan Turing. And he was instrumental in developing this, and they had a system called the imitation game, which is basically machine intelligence. It's a machine intelligence test that's carried out, and that's what led to the birth of AI. It's been used in medicine and dentistry for ages as well. Sorry, in medicine for a while now. But AI is, to put it simply, is a set of algorithms that work together to accomplish goals set by humans. Computer scientists train these algorithms by feeding them troves of data. This sort of process is called machine learning. And the algorithms learn to recognize the pattern in information, which ultimately allows the AI to accurately categorize and make predictions about how we show it. So like I said earlier, it's been around in medicine for a bit of time, and it's been used in the heart, the brain, and the lung scans. So why can't we use it in dentistry? You know, it's used accurately and for precision and speed in medicine. So let's bring it to dentistry. And so Pearl did. And Pearl is one of these companies that use this technology successfully and are rolling it out to dentists. But how did I get involved? So for me, I got interested a few years back when I went to the Chicago Midwinter Conference, and I saw Pearl exhibiting there along with other companies, similar companies. I had a few demos and was really kind of wowed by it, and I thought this would be perfect for my practice and my patients. Eventually, being that I believe that we're a progressive practice, and I'd like to think we want to keep improving our patient experience, our patient service, patient journey. So I thought we needed to get involved with Pearl and bring Pearl to our practice. And setting ourselves apart from other practices is the key to moving forward, I believe. So just a little bit about the X-ray evolution. So when I first started dentistry in '94, we had the old film X-rays, and it was interesting. At the time, you would use a automatic processor with fixers and developers in the machine, and you'd come out with an X-ray, pretty much as you can see on the left-hand side. Interestingly, before this, the forefront of this was the old darkroom. And when I actually bought my practice in 2000, the previous practitioner actually had a darkroom where he was processing the X-rays manually and hanging them on some paper, so wire mesh type thing, and letting them develop over a few days. And when I saw the patients for the first time, they were like, "Oh, we've got to come back to see our X-rays." And I said, "No, we've got an automatic processor." So they were a little bit, "Wow, things can be seen in 5 minutes." Next, the evolution went further and digital X-rays came about. And we actually bought a digital scanner in, we went digital 2012/2013. And changed, obviously, the quality of the X-rays, the consistency of the X-rays. And again, going from 5 minutes processing now to seconds. The next logical step then was AI technology to read those digital X-rays, and we purchased Pearl around about June, July, and have been using it since to great effect. So from what we've seen is, if you look at the manual X-rays, we were throwing them up, and the patients look at these X-rays. We're fortunate as clinicians. We've had the knowledge. We've studied at uni and had further training on X-rays and how to interpret them. Our patients just see black and white. They don't know. They kind of go with our judgment, and you build up that trust over a period of time. But the reality is that according to the data, 65% patients really don't understand what they're looking at. They're nodding their heads when you're telling them something's wrong. Of another 59% really don't trust what they're being told. And, you know, when you tell them that you've got a carious lesion, they'll be like, but nothing hurts, doc. Or, you know, why do I need that treated? Why have I got a hole? I'm not having any pain, any signs or symptoms. You just want to drill for the fun of it. And 78% say trust in diagnosis is key for them to accept in treatment. So, you know, you build that trust up with the patient over a period of time, but use adjuncts. And, you know, in the past, we've been using, you got X-rays, and then you couple that with intraoral cameras. And then now we're using intraoral scanners with NIRI technology, so infrared technology, near infrared technology. So that helps show patients what's going on. With the AI added to this, it's just going to increase that level of trust. And you're using every single tool available to you to explain to patients what is going on in their mouths. So here are a few points that I believe will transform the way AI is used in your practice. Some have become evident with what I've been doing over the last few months. And you can just see things like improved accuracy, diagnostic accuracy. I'll go through a lot more of these points as we go along, but these are really more pertinent to what we've been doing. And so if we start with the increased diagnostic accuracy, Pearl can detect many things from early carious lesions, established carious lesions, obviously, and bone loss. We've got calculus, we've got deficient restorations, pathology, ledges, calculus, apical lesions as well. So earlier detection and more accurate diagnosis is given to the patients by using this sort of technology. You can use by seeing things early, you can treat things early and prevent the disease progressing further. And ultimately, that will always give a better patient outcome. As you can see from this X-ray that we took of a patient recently, there's a few things that we see from the X-rays, and we can sit and talk to the patient about. One is their bone levels. And these numbers represent the amount of bone loss from the CEJ to the bone crest. And where it's increased a little bit, we can explain to the patients why it's increased, where they need to focus on their cleaning. And then on top of that, you can see the pink lesion, and that's basically early caries. So it helps detect early caries. You may not see it clinically, and it may not even be visible to the naked eye on an X-ray. So once you've seen it, you can explain to the patient what's going on, and look, here is an area of early caries. And our feedback has been that the most common question they ask straight away is, so what can I do about this? You know, how can we treat this? And obviously, being 100% into enamel, we won't intervene, but we explain to them how they can keep it clean, how they can do their best to slow the progress of that carious lesion, or even arrest it with different methods. Pearl has has really done a few studies, and it's said about 37% more disease is detected, which is kind of synonymous to what we see in our patients at the moment. That we are definitely seeing more, especially the early carious lesions, and more importantly, on top of that, we are getting more patients coming back for other treatments as well. On what they've seen on the X-rays, they trust the diagnosis, so they're having their treatments done. We all miss things in a hurry. So basically, with Pearl, things are highlighted, and Pearl will point you to areas that you've missed that may need further looking at. So with Pearl, again, a case scenario I've put up there, but we have a lot of consistency, and there's a reduced human error in what we see and find on our X-rays. Taking a couple of bite wings, areas are highlighted, early carious lesions and late carious lesions. So this X-ray that I put up is obviously the same bite wing, right-sided bite wing, showing two things. One is the early decay, which is 100% into enamel, but another one showing a late or progressed caries, which shows it's about 45% into the dentine already. And then, coupled with that, by explaining to the patient the difference between the two, and you're more likely to take up treatment. And the early lesions you can monitor with X-rays on a more regular basis, and see how that progress has been made, rather than guesstimating it or eyeballing it as we used to do. The Pearl also reduces the chances of any missed areas, or any false positives, misinterpretations, so the results are more reliable and more accurate. Enhanced workflow efficiency. So for us at our practice, we found that the whole patient journey has changed with Pearl. We find that by having Pearl in the practice, it speeds up my diagnosis process. So I have more time focusing on the patient care, rather than spending time looking at X-rays. Obviously, I will look at X-rays and scan them first, and then use the Pearl software, and it will highlight areas where I need to go to straight away. And that allows me to spend more time talking about these lesions with the patient, rather than waiting in the chair while we scan through things. So patient care is the focus of our attention. And the process of viewing an X-ray is streamlined. So by streamlining that process, again, productivity increases. You have more time on your hands to spend with the patient. So with the cost effectiveness of Pearl, I mean, you find that patients don't always understand what's going on in their mouth. You try your best to explain things, but by visually showing them what's going on, there is less chance of misdiagnosis and delayed treatments. So what we find is that a small lesion, you explain to a patient, they're more likely to take the treatment on, and hence it will be less costly for that patient. Or if you've not seen it on your own X-rays, you'll find, and that lesion progresses into something more, a larger restoration, for argument's sake. It saves the patient time and money, and also gives you more time to focus on other aspects. The patient isn't coming back for more treatment or more lengthy treatment. So we find with our patients, all the patients now are very much tech savvy. They see things on social media, they read Google, so they know what's out there, they know what's available. They do expect a practice to be high tech now, and they want state of the art healthcare solutions and treatments. They want a practice that has up-to-date digital x-rays. They want they want practices that have scanners that can look at your teeth and look at the wear on your teeth, look at lots of things, intraoral cameras to see what's going on. So Pearl is another tool, and you'll find that once the patients have this visual aid, they start their trust and satisfaction with yourself is increased. It shows that you're committing them. Your practice is committed to top tier level of care. They appreciate, we found our patients have really appreciated the speed and the precision of the software, and they really do trust, and their satisfaction has improved. Our feedback from over the last few months has been that our patients are highly impressed that we are keeping up to date with new technology and investing in their own health. That's really the best feedback we've had so far, that they're wowed by what we have on offer and what Pearl can do for them as well. So this data really we got that Pearl have found is from 1,000 US consumers. So it is a bit American centric, but it does apply to the UK as well. 63% of patients are really uncertain if their dentist is reading their x-rays accurately, and that goes down to them not understanding what they're seeing. 55% of them would feel more confident if another dentist verified their x-rays, especially when you say to someone you've got decay in your mouth and they've been told there's nothing wrong. So there is that trust has to be gained in other ways, and visual aids is the main thing, I think, so they can understand. Though we've got to remember that patients are not trained to read x-rays. They have to trust you, and this is using Pearl is an added way to gain their trust. 82% of patients would prefer that their dentist use more advanced AI technology and diagnostic aids in helping them understand their x-rays. So with scalability, this is kind of for those principals that want to buy more practices, it's an ideal tool to have, because two things really, I feel. That one is that you've got associates and can help them diagnose and treatment plan cases. You've got a lot more consistency between clinicians. So a practice with multiple clinicians on site, the accuracy is the same. We all see x-rays and we all read things differently on an x-ray, but Pearl doesn't. Pearl is the same for every case, for every clinician using Pearl. So there is consistency with what is being found and what is being interpreted from the x-rays. The patients are not being told different things. They have consistency with the reporting on their X-rays. Obviously, the software itself can handle increased amounts of data and patient volume without requiring additional staff. My belief is that AI is the future of dental care. We've been using AI for multiple things. AI is used in our note keeping. We use it within our scanning. There are even telephone systems out there that will record the conversation and put down a summary of it in a Word document instantaneously. So AI is definitely the future of dental care. So why not bring that to region of our X-rays as well? Adopting the software now helps you prepare your practice for the future and future innovations, allowing you to stay competitive in the market. As the technology advances, I feel early adopters will be in a better position to integrate new features, and technologies further will improve the practice performances. So looking at some data, again, it's a little bit US based, but some of these figures are quite interesting, really. So looking at the first one, 46% increase in treatment volume for restorative fillings, restorative work, and 12% increase in hygiene. That's, for me, that's bread and butter dentistry. So Pearl is helping you increase your production by highlighting areas that you may have missed from your X-ray diagnosis, but also it helps with the patients understanding what's going on in their mouth, and more treatment is probably taken up. We have definitely found an increase in our treatment uptake since using Pearl. Patients understand more about their mouths, they understand what they're seeing on the X-rays, and they literally, their question is, when can I get booked in to get this done? And that's the bread and butter. Couple that with further treatments that may be needed down the line, crowns, implants, they can see the angulation, they can see space closures. There's a lot more they can understand from a color X-ray than from a black and white X-ray. And Pearl, for me, is perfect for this. Back to confidence and trust. We've been seeing a lot of more patients since COVID. A lot of patients are coming back to us after 4 or 5 years who haven't been worried about COVID. COVID was always on their mind. Now, when they've come into our practice, their focus is more about AI. Oh, the practice is now using new technology. It's got AI, and they really, really are impressed with that. They see things, as I've said, they are more tech savvy. They've heard about AI in various guises, and then you tell them we're using it as well in X-rays, and it's like, wow, well, this is amazing. You know, we find that 71% of patients, Pearl have found that 71% of patients will trust a dentist diagnosis if backed up by AI. I mean, that speaks volumes, because there's obviously a little bit of patients are unsure about what is needed. They come into the dentist knowing that they feel that nothing's wrong in their mouth, and then they've been told they need 1 or 2 restorations, etc. This just backs up what they're seeing. Visually, they can see what's going on, and you can demonstrate that using the software. I think using the software, the patients are more assured. Definitely, our patients feel they are more assured that by using software, there is more accuracy in diagnosing what's going on in their mouth, and their quality of treatment seems to be what is necessary, what is important to them. They want the best, and we're giving them the best as we can with all the technology that's available. So with compliance and documentation, Pearl has, we all have to, when we take, sorry, let me backtrack. Pearl, when we take x-rays, we have to document our findings. We have to report on the x-rays. And Pearl kind of helps with this process. It complies with the legal requirements and the industry standards. There is a button on the Pearl software app that will allow you to do a printout what you find. So it will diagnose, Pearl will actually show you the lesions that are there, the levels of bone, etc. And you can print that out, attach it to your patient records, attach it to your treatment plan, and you're complying with the requirements. Obviously, the records, the records are there kept. You can compare the records over a period of time, like x-rays. If you've got lesions that are small, a year later or 18 months later, when you take the next set of x-rays, those measurements can be compared, and you can see if there's a deterioration in those, and does it need intervention, does it not need intervention. One other way, or the best way for me to really go through compliance and the legal requirements, I think, is to go through a case study. A real life patient that came to see us in August. He'd been seen at another practice a couple of months prior to this, had an examination, a couple of bite wings, and a quick clean, and was told nothing was wrong. A bit of his history was that he had a restoration done on the lower left six months ago, and it kept breaking. And I think he had it repaired two or three times since. He was recommended to see me for possibly some other work that he was interested in, but at the time he came in to see me, the lower six was giving him a few problems, and he was told nothing was wrong by his previous dentist. The problems were the occasional sensitivity with hot and cold. Previous dentist had just said, look, everything's fine, x-rays are fine, just use some Sensodyne, it will settle down. Looking at the x-rays, we obviously requested these x-rays from the previous practitioner, and looking at them, you can probably see a couple of lesions on the premolars if you look closely. I know the accuracy or the quality of these digital x-rays are not great, but even on this poor quality, you can make things out, and the deficiency of the lower six restoration. We explained the deficiency on the six. You could see it was clinically was also breaking down, and it needed some intervention. We went through his case with him and said to him that, look, once we'll restore the six. Once we got the x-rays, I called him back for a second consultation, and we put the x-rays into Pearl. And a few things showed up. We highlighted the calculus that was visible, was there, and then we went through all the pink dots with him. The early carious lesions first, explained to him that these are early, they don't necessarily need intervention. But some of the other two lesions did need intervening, and he was booked in for the restorative work. We put it into the colour as well, and you can quite clearly see that some of these lesions had gone into dentine and needed active intervention. And the 6, he could quite clearly see the deficiency in the restoration. So the treatment took 2 or 3 visits. We restored him. He had some hygiene work done, and now he's currently in the middle of some Invisalign. Very happy, and the 6 is stabilized. It just needed a simple intervention. A composite restoration was done for him. If we'd have left that, you probably would have found that may have progressed or deteriorated into something larger. So early intervention or a timely intervention was the key. Some of the other x-rays we took of this patient as well, you can see the OPG, again, Pearl. You can import the OPG into Pearl and it will show the carious lesions. It will go through some of the anatomy quite nicely. And it's all things you can explain to the patient. And it looks all very pretty as well. The patients can understand things very clearly. Pretty much a sense of co-diagnosis is really important. So in summary, we have a few things. Pearl's great at diagnosing or guiding you of where lesions are. It will tell you there are early carious lesions. It will tell you that there are late carious lesions. Periapical radiolucency is highlighted. Calculus, which means the hygienist can focus on areas where he or she is needed to clean, and the patient is needed to clean those areas. Possibly periodontal treatment, further periodontal treatment may be needed. Bone levels are monitored. You can overlap these bone levels with x-rays when you take them in the future and see if there is any deterioration. And the patients can understand that more, rather than visually just showing that there might be a little bit more bone loss than normal. You've got a bit more of an accurate measurement to say that, you know, you're beginning to lose a bit more bone here. We need to intervene more, or we need to refer you on further, so on and so forth. Restorations can be monitored. Ledges or margins, you know, we can intervene a lot earlier rather than let that things deteriorate and suddenly a root canal develops. So when we qualified, we were all told one thing: you can't treat what you can't see. So get some loops and maybe an additional light as well. Now, I think the focus is slightly different as well. You can't treat what you can't diagnose. So maybe we need to get Pearl as well to help us with this. Thank you for listening. Any questions?
Thank you, Nishan. That was very interesting. Thank you to the audience. You will have some CPD questions to answer to be able to obtain your CPD certificate. We'll leave this up for a little while so you can grab a screenshot or access the website to get a demo booked. Have a lovely evening. Thanks, Nishan.
Thank you.